Hey guys, Dr. Mike Allen, Precision PT and Performance, here with Dr. Carly Allen.
Hi there.
I wanted to shoot you guys a video with a couple exercises to help improve thoracic mobility. Now the thoracic spine is the middle part of your back. Okay, so we're talking about the spine from the bottom of your neck down to where it meets your lumbar spine or your lower back. Okay? This should be a fairly mobile part of the spine, especially with rotational movements, and I find this to be a pretty stiff area in a lot of people. This can affect the neck, can affect your shoulder motion, can also affect your low back. So it's very important to establish good mobility through the thoracic spine. We're going to show you a couple of different exercises. The first one's going to start with a foam roll. If you don't have a foam roll, you can just take a rolled up beach towel or something, just something round to create a leverage point underneath your back. Okay, Carly's going to lay on her back across the foam roller. And I usually like to go hands behind the head just to keep the neck supported a little bit. Now we're going to keep the chin tucked in. We don't want the head extended backwards. And she's going to extend straight down over top of that foam roll. Good. We want to try and keep those ribs down and keep that in a nice neutral core position. Okay, and then back up. So you notice she's not arching over top of the foam roll. All right, we don't want to arch over top and let those ribs flare out. We want to keep the core nice and neutral, and we want to extend straight down. Okay? So you can hit that for about 10 repetitions and then move on to the next exercise. Okay, the next one is a rotational exercise we call the open book. For this one, you either need a small pillow or a couple of towels to put underneath your head, keep your neck in a nice neutral position. This one's done on your side. So Carly's gonna lay on her side, and we're gonna make these towels high enough that her head is nice and neutral, okay? Knees and hips are going to be bent up to 90 degrees so that your thighs and your knees are pointing straight ahead. You're going to use your bottom hand to stabilize or hold down on the top of your thighs. We don't want, as you're rotating, we don't want those thighs popping up in the air, okay? We want to lock that low back down, holding those thighs in place. The other hand goes on the center of the chest or around the contour of your ribs. We're going to call this a neutral position. She's going to take a nice deep breath into her nose. As she's exhaling, she's going to rotate down to the floor as far as she can. Okay, the rotation should last the duration of the exhale, and then she'll come back to a neutral position. You can use that hand on your chest to give yourself a little extra pull at the bottom of the motion, and just create a little bit of overpressure, a little extra pull. Okay, slow controlled motions, keeping the legs down, rotating through that thoracic spine. Okay? So try that one to help improve rotational movement through the thoracic spine. Okay guys, the next one in the series of thoracic exercises is the quadruped rotational exercise. And what that means is we're going to do that on our hands and knees. Okay, so Carly's going to start on hands and knees. We want the knees underneath the hips and the hands underneath the shoulders. From here, what she's going to do is she's going to sit back onto her heels a little bit. And what that's going to do is create some tension through the low back, and that's going to help lock out the low back a little bit more so that we're getting most of that motion occurring up through that mid-back or thoracic spine. She's going to take one hand and put it back behind her head. Now I like fingers on the side of the head versus palm on the back of the head. That way you're not pulling on your neck to complete the exercise, okay? Fingers on just loosely on the side of the head. Now what she's going to do from here is we can rotate underneath, and then she's going to rotate all the way up as far as she can. Pretend like you're in a nice tight container and that you don't have any side-to-side movement available. We want to just be rotating, okay? So no shifting side to side as you're rotating upward. Okay, try and exhale through the stretch. Good, and then all the way back down. Okay, creating that nice rotational movement through the thoracic spine. All right, try that one again to improve some rotational movement through your thoracic spine.